Hi everyone! Welcome back to my channel and welcome to all new viewers. My name is Olka and I'm a UK-based vet, and today I'd like to talk to you about your puppy's first visit at the vets. Before I get to it, please don't forget to like, subscribe and ring that bell if you enjoy my content. I aim to release a video every week. Before I progress with the topic of the video, let me insert a little disclaimer here. Certain protocols may vary depending on the country and even between veterinary practices. Scientific studies and research also get updated frequently, which means that the general advice in the future might be different. So let's jump into answering the question asked. What does your new puppy need and what will be likely done at its first appointment at the vets? Well, exciting days! You've just extended your little family. All you want is to spend time with your new little doglet. Take care of it, play with it, cuddle with it. But you're also probably thinking about its health, preventative treatments it might need, and what is generally recommended to your puppy in those early weeks and months of its life. Firstly, you should phone the veterinary practice of your choice and register your pet. Consider proximity when you do it, as in case of emergency, you might want them nearby. I think it's a good idea to do it as soon as you can, because sometimes you need to wait a few days to a few weeks for an available appointment. The first person you speak to will likely be a receptionist. They are usually quite knowledgeable and will be able to answer your basic initial questions if you've got any at that point. When you book your puppy in for the first time, you should be aiming for it to be between 6 and 8 weeks of age, unless it displays any concerning symptoms. If it does, it should of course be done sooner. So what will happen at the vets? Firstly, your vet will call you in when they are ready for you and probably ask a few questions, like how your puppy has been doing, what you've been feeding it, how long you've had it, etc. If you've got any records for your puppy, bring them with you. If you got your puppy from a reasonable breeder or adoption center, you would likely have been given some documentation and instructions. These can be useful for your vet to help you and your little one as well as they can. After the initial conversation and so-called history taking, your vet will then usually examine your new pet, checking it's in a good condition. If so, then you can discuss the routine, preventative healthcare and other important points of your puppy's development. If your vet has any concerns, they might want to withhold routine treatments at this stage and progress to try and solve the problems found. One of the most important things to do would of course be vaccinating them. Current guidelines say to vaccinate your puppy for the first time at 6 to 8 weeks of age, then for the second time at 10 to 12 weeks of age. However, the interval between both of the vaccinations should be 2 to 4 weeks. These protocols are the ones I worked with practicing here in the UK. The most standard, so-called core vaccinations your puppy will receive by the time they are 12 weeks of age are vaccinations against parvovirus, canine viral hepatitis, distemper and leptospirosis. The optional one would be one against kennel cough. Some owners decide to get it, some don't. Kennel cough can be a nasty disease, however, nowhere near as bad as the ones listed before. In the UK, rabies isn't a concern, as it's not found here except in a small number of wild bats. Some countries, including Poland, have laws in place to enforce owners to have their puppies vaccinated against rabies, as it is a zoonotic disease, meaning humans can get infected. If you plan to travel with your dog abroad, it is likely they will require rabies vaccination. After the initial course of puppy vaccinations, your dog will need to be vaccinated every year against leptospirosis and every 3 years against parvovirus, canine viral hepatitis and distemper. You and your vet will likely discuss deworming protocols. The protocol I'm used to is to deworm them every 2 weeks until they are 12 weeks, starting from 2 weeks of age, then every month until they are 6 months, and adult dogs once every 3 months. However, it depends on your geographical location and your dog's everyday life. Your vet will be able to advise you on the product you should use. There are many of them available. Then we've got our external parasites. Here, most commonly, we will deal with fleas. However, these are not the only ones we should be concerned about. The protocols I'm familiar with would be to wait till their second vaccinations to give them their first dose of preventative anti-flea product. If your vet discovers fleas before that date, they will treat them sooner. There is a variety of different products. Some of them need to be repeated every 4 weeks, some every 3 months. So, the frequency depends on the type of the medication you will use. Most products currently used fight off not only fleas, but other external parasites as well. Before I jump into the next section, please remember, before coming to your vets, try and find out what and when your puppy has been treated with already. If you don't have this information, there is a risk your dog will receive medications before it is actually needed, resulting in unnecessary overdosing. So, ask your breeder, adoption center, or your partner if they've given them anything. Keep all the leaflets of products used in case your vet needs this information. Next important thing is microchipping. Legally, in the UK, all dogs should be microchipped by the time they are 8 weeks of age. Because of that, it is very likely that your puppy will have already been microchipped by the time you got it. If not, you should probably do it at their first vet appointment. After microchipping, by inserting a rather large needle in between their shoulder blades, you or your vet will register your and your puppy's details online. If your pet gets lost and someone scans their microchip, they will be able to get the dog's individual number, access your details, and finally contact you. Some of the vets will discuss your pet's health insurance with you, especially if you don't yet have one. Vets do not provide insurance per se, but most of us encourage it, as in case of illness or injury, the cost of treating can be rather high. So it is a good idea to sort it out. Most insurance providers don't cover pre-existing conditions, so remember to get the insurance before your pet becomes ill. Your vet, depending on the practice, might discuss with you a variety of preventative healthcare plans. These plans provide services like vaccinations, anti-parasitic medications, microchips at lower prices, sometimes discounts on other products too. In exchange, you normally enter a contract where you pay some amount of money every month or a bigger lump sum upfront. If your vet doesn't start this conversation on their own, it might be a good idea for you to ask about your puppy's diet. Most vets will be able to recommend an appropriate commercial diet based on your puppy's age and requirements. Lots of veterinary practices have some deals with certain brands. However, it does not mean that the food they are recommending is bad, or they are not allowed to discuss other brands if this is something you'd like to do. You might also want to discuss socialization, which is a very important part of puppyhood. The more experiences and situations they are exposed to, the more confident and well-rounded they will be as older dogs. It's a good idea for them to meet different people, animals, outside spaces, noises, smells and objects. However, it can be a tricky thing to approach correctly, because your puppy is still in danger from the diseases which we vaccinate against up until 1 week after their second injection. So it is essential to find the right balance between keeping them safe and healthy and socializing them with the outside world. Introduce them only to healthy, fully vaccinated dogs. Walk them or exercise them only in places where no other animals have access to. There is no ideal solution here, unfortunately. Your vet might also want to discuss with you future neutering plans. It's good to consider whether this is something you'd like to do in the future and why. Whether you decide to do it or not, there are certain advantages and disadvantages to both. At some point I will make a separate video to discuss those, but in the meantime this is something you can certainly ask your vet about. If you've got any other questions or concerns, don't be afraid to ask your vet. They want your pet to be healthy and are usually very knowledgeable and helpful. And lastly, thank you for watching. I hope you liked my video, like, subscribe, and I hope I'll see you here again soon. Bye!